Hey everyone, welcome to the main event. Make sure my audio is good. Yeah, it is. You're here at main event on, was it Thursday, April 27th, 2023. Thank you for joining us. Got a great show for you today. I'm pretty excited about it. But before I get to that, if you don't know who I am and what I'm doing behind this microphone, in front of this camera, my name is Joe Tillman, and I've been in the hair transplant, hair restoration industry for 20 years. And I got my start as a repair patient where I had two bad strip surgeries, almost 30 years ago. And I had two wide donor scars, lost all my hair on top because I didn't have access to preventative medications at the time. And I walked around throughout my 20s with the only hair in my head being these ant legs that looked like they were on growth hormone sticking out of my forehead because that was the only work I ever had done. It looked pretty bad and got repaired. And that was the beginning of my journey into this passion of mine, which is the hair transplant industry. I worked for 11 years with a fantastic clinic and branched out to where now I'm working with some fantastic doctors worldwide. I've got about 15, I think, doctors that I'm working with worldwide. And I'm working with them and presenting them to you as serious clinics to consider because I've done the legwork on researching these clinics. I've been to a lot of these clinics to use my experience to actually review how they do things. It's not just about pretty pictures for me. Anyone can make a list based on pretty pictures. I dig a lot deeper than that. And with that said, one clinic that I have dug deeper into beyond the pretty pictures is that of Yaker Hair Restoration in Plano, Texas. And we have with us today Dr. Joseph Yaker live, hanging out with us. Love the surgical cap. It looks like one of the video game I'm looking for a video game reference. I can't say it. Military reference.
There you go.
Yeah. How you doing, man?
I'm doing great, thanks. That's a nice little jam intro song you got going on there.
Thank you. I want to make sure the audio is coming through on everyone here. Hold on a second. I was juggling a lot today. I think everything's come through. Everyone in the chat room, can you just confirm that we've got sound coming through for Dr. Yaker? I haven't had anyone on air in not since last Friday. A little bit of a delay, so I'll wait for that confirmation. But it's great to have Dr. Yaker with us because I've started an effort to get all the doctors I work with live on camera so that you, my subscribers and my viewing audience can ask direct questions to these doctors because you don't get access to them unless you go through the motions of a consultation and things like that, which is understandable. But it's nice to have Dr. Yaker on board as a Hair Transplant Mentor accepted member, and it's fantastic to have him here with us. Doc, I'm trying to figure out where to start here. How long has it been since we started working together? Is it 2 years now?
I would say it's a little over 2 years, probably 2.5 years.
Okay, right on. Excellent. So for the audience that may not have seen you yet, can you give us a little bit of or give them a little bit of a background of your experience and what you're doing today and what your core beliefs are as far as hair transplant surgery?
Yeah, sure. So I started my practice in 2015. I was trained by Dr. Mark DiStefano in Boston. Had a lot of volume there, which was wonderful because the confidence that I had when I was ready to start on my own was invaluable. Mm-hmm. Being fellowship trained is truly important in this field. A lot of times when you go on YouTube or you go on forums, we make the process look simple. There's 3 steps. We remove hair, we make incisions, we insert hairs. There's a lot that goes into it. And if you don't have experience, you don't have volume, and you don't see everything, it can really catch up to you when something goes awry or if something's a little bit trickier than your standard bread and butter. So I try to present that to my patients. My consultations are thorough. The purpose is to kick the tires, get an understanding of what's going on, because it's nice to have accessibility to online research, etc. But if you don't have the background or the hands-on training, it's very hard to decipher what things mean or what's real, what's not. So I truly do spend the consultation process going through 3 different parts. I talk about the scalp, I talk about the hair shafts, and then I talk about the hair seeds or the roots. And I kind of explain how this is a 3-step process, because obviously with hair loss potentially being a chronic progressive disease for a lot of people, it starts with scalp hygiene, it starts with how to take care of the hair shafts, and then of course what we can do to prevent, minimize, or future loss, or even rethick and thinning hair. But results from a hair transplant are only as good as the hair you keep. If we can make thinning areas thicker, fuller, and then there's the need for a surgery in between, within or around, you're only going to look as good as the surrounding cast. So that's really one of the biggest points that I preach is, you've come to me, you may have some frank hair loss, but if you have some left, you have to work just as hard to save that. So that way you feel like not only the time and money spent on getting the hair restoration obviously is very important, crucial, but you don't want to maybe have to go down this path again if you can prevent it.
Right on. Okay, that's a great way to describe it. And what I can say when we were first learning about each other is I was impressed with your consultation philosophy, where you do throw a lot of information at the patient, which can sometimes be overwhelming, of course. But you're keeping open lines with these patients so that if they do have questions, they can get back to you and you can clarify or reiterate something. And I think that's fantastic. So I did have one question that popped up in the chat room that I think is a great start to this before we get to phone calls. And I will tell people that this is a call and talk show, so you can give us a call and ask Dr. Yaker some questions personally. Phone number is 833-563-4247. Again, it's toll free, 1-833-563-4247. Doc, the question that was asked in the chat room was by Milk Drinker, his name, and he says, is FUE on par with FUT in your view? Good question.
It is a great question. I think that every doctor will have their own experience or their own philosophy on it. I think that with anything in life, when something is new or new-ish, it takes time to master something. So when you have the first version of the TV, the first version of a car, there's always going to be issues, right? So you learn from that. I think when the Godfathers created FUE, at the beginning, there was a lot of trials and tribulations to figure out what works. But if we look at the world statistics, even in my office, we're probably about 65% FUE and the remainder is FUT. Mm-hmm. And we still, in my opinion, still see similar results in terms of growth yield.
Right. And so I just assume that the reason why it's 65% roughly FUE in your practice is because that's what patients are wanting when you present those options to them. They say, well, I'd prefer to have the non-linear scar procedure, basically, which is what drives FUE to begin with.
Absolutely. A lot of times when someone is going in on that and they've done research, they just focused on the FUE, whether they've heard of it before, someone had it, that's a friend or a family member. But then when I talk about that they have to shave the back and the sides, things like that, maybe they didn't catch that part. And so they go, oh, I don't want to do that. And so when we show how we shave a very small zone for FUT, the scar is a thin, fine line, and that you can cut your hair quite short, half an inch, or a number 4 guard on a clipper, sometimes just a little bit shorter. They go, oh, I'd rather do that. For a lot of my patients, when they have to go back to work right away, or they're more front-facing, whether they're having to be on a podium or they're running a company, etc., they need to get back quicker. And we know that with FUT, having that hair above drape over the scar allows them to get back to work much quicker. Yeah. And also, in my opinion, the benefits of the FUT is that if someone is advanced, we can get more hair in one session. We do a lot of combination cases where we'll do FUT on day 1. They come right back and we'll do FUE on day 2. And there's times where we're getting 5,100, 5,400 grafts in a 48-hour period. We're, of course, very conservative with our approach to minimize any risks of having such a large procedure in 48 hours. But they're having so much of their hair restored in 48 hours with one recovery that it makes them very happy.
Yeah. Okay. Excellent. So I'm going to throw this question at you just so that people can get an idea on your philosophy on this. Can you explain your approach on preventative medication and how that relates to candidacy for surgery at your clinic?
So whenever a patient walks into my office, I am going to assume that they're going to live to be 100 and they're going to look like Larry David or Danny DeVito. And that's the mentality I have to have because I need to be the advocate for the future patient self. So April 27th, 2023, patient does not see the future that we see sitting on this side based on experience.
Mm-hmm.
So when someone comes in, they're hyper focusing on their current concerns. So let's say for the sake of this discussion, they just have a little 2-car garage. They have their M pattern going. They're a level three or a 3 vertex with a little thinning in their or balding in their crown. I have to assume they're going to get to that 6 or 7. So if they only focus on restoring this and not taking medication, they will eventually not get to enjoy the final results because as more continues to leave, we all know how unnatural that looks. So I always gonna kind of try to play lighthearted with our patients because losing their hair isn't fun. So I try to be, cheesy, fun, lighthearted. But if I'm going to restore your 2-car garage and everything else goes, you're going to have devil horns. If I restore your crown and you lose out, you've got a halo. So are you the devil or are you the angel? You got to figure that out. But it's not going to happen due to my watch. We all know that there's bad seeds in every industry, from food services to car dealerships to cosmetic surgery. I have to be that advocate for the future of this person because they don't know any better because they're not in this. So this actually happens on a daily basis. I had one today. It was a 26-year-old gentleman. He was a Norwood 4 creeping up to a Norwood 5. He's anti-medicine, does not believe in putting anything in his body, which I completely respect. No one, of course, is forcing it. But through education, we explain the hormonal process that's turning on your genetic light switch, and there's no way to turn it off, and no way of knowing if it ever will turn off, I should say, right? We don't know if he'll stay a 4, but being in his mid-20s, already a level 4, multiple male family members with a Norwood 7, we know where this is headed.
Yeah.
And when I showed him his pictures, he was a out-of-state patient. When we did the virtual, you can see in the light that his crown was going to be a low-lying crown because the DHT was already kind of thinning the hair. It was getting a little lighter in color. And he didn't realize that. And when I showed it to him, he understood. So I just tell them, we just want you to understand the brevity of the situation, that surgery only fixes today's problem. It cannot prevent tomorrow's.
Yeah.
And hopefully he'll think about getting on medication. And if we can see that he's compliant, responsible with it, we'll reconvene in 6 to 9 months, and then we'll see if he's at least stabilized, and then we can proceed from there.
Yeah, I like the cautious approach. Don't do the surgery now. Just stabilize if you can, and we'll reevaluate. Reminding everyone, this is a call-in show, so you can give us a call and talk directly with Dr. Yaker and ask him your questions. The number is toll-free, 1-833-563-4247, toll-free in North America, and you can call using Skype or any call app from anywhere on the planet and speak live with Dr. Joseph Yaker. So, Dr. Yaker, I know that with these patients that are coming in, the question becomes, well, there's oral minoxidil out there, there's oral finasteride, there's topical variations. What do you talk about with your patients with regards to the options out there for them?
Well, the first thing I talk about them is manufacturing and processing, right? We hear medications, you go to your local pharmacy, you pick it up, it's in English, the bottle's in English, and so you assume everything is manufactured here. It's very important that patients understand that the majority of finasteride is sourced overseas. So whether you go to a local pharmacy or you're going to these new online websites, which are super convenient, they're all getting them from more or less the same manufacturers. We know that because of the change in quality as compared to what's made in the United States, the efficacy, the dosing, the purity is going to be less. We are obviously very respectful of people's budgets. If that's what they want to afford, that's fine, but it's important that people know that. So I kind of get a little bit deeper in the underbelly of where things are coming from. And then taking one step back, the same is also for supplements. Everyone comes to me on biotin and all these brands that are coming out with really, really nice PR and marketing, spending millions of dollars. But at the end of the day, if a vitamin brought your hair back, we wouldn't be in practice. If a shampoo brought your hair back, we wouldn't be in practice. So I always joke that I'm always the last one that a patient needs. They come with a bag filled with stuff and they take it all. And I'm like, if it worked again, you wouldn't need to come see me. So I kind of start with what USP verified means in terms of supplementation, and that majority of supplements we buy are not regulated at all. So what's in the bottle may not necessarily be what it's stating in the nutritional label.
Right.
So we talk about that. We talk about shampoos and what's important in a shampoo. You need an acidic formula, right? So our scalp, our face, and our body are all one. But for some reason, a long time ago, someone has created this myth that washing your hair is super detrimental. And washing your hair daily for people who have very dry skin, very sensitive skin, very brittle hair, understood. But if I remove my hair, my scalp and my face are the same. It gets sweat, oil, debris, dead skin cells, hair products, maybe even minoxidil products. And every time you take that on, you're driving your pH levels away from where it needs to be. It needs to be in an acidic state. Mm-hmm. So we all have a very, very thin, invisible layer called the acid mantle. It's protecting us from outside invaders. It can get broken down when the pH levels rise. Right. Your hair shafts are extremely acidic. And so when that also has a rise in pH, it'll open up our hair window and it can drive water out. So truly using a low pH shampoo and conditioner is there to sweep away all that dirt, oil, sweat, debris, dead skin cells, hair products, restore your acid mantle pH. And by restoring your shaft pH, you're driving water back in. So it's helping hydrate your hairs.
Right.
And so a lot of people complain of dry, brittle hair or frizzy hair. Sometimes it can be something as simple as just not having the right shampoo formula.
Okay. All right. We got a call on the line here. Sorry?
Yes, sorry. No, I was going to answer your question, but I kind of wanted to start with what I talk about.
Right on.
Can you hear me?
Yeah, I hear you, caller. What's your name? Where are you calling from?
My name is Sam, and I'm calling from Chicago.
Sam from Chicago. You got questions for Dr. Yaker?
Hey, Sam.
Yes. So I was going to ask about the FUT. So I got, FUT done maybe 11 months ago from Chicago, downtown Chicago.
Yeah.
And the pain was really, really, high in terms of what I expected. And now I'm kind of scared of going through the FUT again. But, with my limited supply of hair graft, I don't have enough grafts that I can go through FUE. But then I'm also a little bit scared, to be honest, to go through the same thing again. Mm-hmm. So what's the Dr. Yaker's advice on,
are you able to hear Sam?
I think so. How many grafts, Sam, did you have?
Sam?
Yes, I'm here.
Yeah, did you hear Dr. Yaker?
No, I couldn't hear Dr. Yaker.
Oh, uh-oh. Let me just double check the sound here. You should be able to hear him just fine.
Yeah, I can hear you fine.
Yeah, you can hear me fine, but you should be able to hear Dr. Yaker just fine. Dr. Yaker, can you give a test 1, 2?
Test 1, 2?
Sam, did you hear that?
No.
Huh. Sorry, guys. Hold on 1 second.
I can hear you fine.
Yeah, you can hear me fine. Yeah,
I can hear you.
Okay, but Dr. Yaker, you can hear Sam.
Yes, I can hear him clearly.
Okay, interesting. Let me try. Yeah. Dr. Yaker was asking how many grafts you had in your first surgery.
I was told that I had a 2,500.
2,500. Okay.
Right.
All right.
And it was my first procedure, so we wanted to be, conservative to see how the growth looks like. I mean, growth is good so far. I'm overall happy with the results. But I had a probably level 6 or level 7 to begin with. So I don't really have a lot of coverage. So I'm thinking about going for a second procedure.
Okay.
And I wanted to go with FUT. But my hesitation is that, is it really worth it? Because my head is still a little bit sore, and it's more than 11 months. And when you kind of, lie down, and then against some object which is really hard, I can still feel it. And as I said, like, for 6 months or maybe 5 months, I just couldn't sleep on a regular pillow, in terms of proper sleep, right? Laying down. So it was a bit of uncomfortable. I'm not sure if this will be the same experience second time you go through FUT. And then I was told by Dr. The name, I should remember the name. Pareen, Dr. Paneen, right?
Paneen, yeah, Dr. Paneen, yeah. He was your doctor?
Yes, that was my doctor.
Okay.
And I was told that, I should be able to do at least 2 FUTs. And I've been watching your show on Friday for almost over a year or 2. And you guys emphasize the importance of going through FUT before you go through FUE process. So I do want to go through FUT, but I'm just, bit hesitant to go through the same experience that I went through first time.
All right.
Where is the pain located?
He's in Chicago.
No, where's his pain located? Is it the
sorry. Where's your pain located, Sam?
Right in the back of the head where the strip is.
Okay.
He said the back?
Yeah.
Okay. Does he have any shooting pain? Is it more of a dull ache? Tender just
is the pain shooting, or is it dull? Is it consistent? Does it come and go?
For the first 5 months, it was consistent, right? I can literally feel something is going to pop out. My, stitches are going to come out even though they were already healed. But after 5 years, now it's getting back to that normal stage where you can feel comfortable, lying against, more solid objects where you don't feel that kind of pain. But I can still feel it, right? The feeling is still there.
Right.
Yeah, and 5 months is a kind of long time to go through that same pain, right?
It seems like it's more nerve related.
So the recovery process is not as usual I expected from your show, the way you were describing that. And I guess it depends from the individual to individual.
It does, of course. Yeah.
Right.
Okay,
Doc, what was your observation?
It seems like this long-standing kind of sensitivity issue is just more nerve-related. There's likely a nerve that's been stimulated or inflamed, and there's certain interventions that might actually help with the inflammation. Steroids, or there's been some talk about Botox that can help, things like that kind of help lessen the sensitivity of the nerves.
Okay. Sam, I'm sorry you can't hear him. I don't know what's going on, but he was saying that it could be an inflammation issue with the nerve endings, and it could be possibly treated with corticosteroid injections to help reduce the issue. But ultimately, it's also a time issue. Some people do take longer to recover from an FET in this manner. I will be frank with you. I don't recall really a lot of cases that have taken 11 months for there to be a resolution to pain issues. And I'm not saying there's anything wrong. I'm just saying that it seems to be definitely on the rare side. So, talk to the doctor about it, and give it some more time. It's not debilitating at this point, right? It's just a distraction. Would you call it not severe?
No, not severe. But it's like the discomfort, right? It's just to have that discomfort where you're already always feeling stretched out in the back of your head. Is that normal? Is that normal?
Well,
out, something is going to pop out, right?
It's not.
What did he say? Stretched out?
Yeah. He's saying in 11 months it still feels like it's being stretched. So there's a
no, I don't feel it. It was still 5-6 months, right? Now I still feel when I put my head against solid objects, so I can feel the sensation. That there was something. It's still not normal.
Okay.
But 5 months was the timeline when actually I was in pain, and then there was one spot where I was feeling my back of my head being stretched out, right? So feeling like, it's probably some stitch coming out, right? Like that way.
Yeah. Okay. So what you're talking about, I think I know what you're talking about. Like when you're pressing on the back of it, like if you're leaning up against a wall, or if you take your fingertips and you press in on the donor region, it still feels almost like a not painful, but almost like a tingling sensation. Is that a good description?
Yeah.
Yeah, that's normal.
That is correct.
That's normal. Yeah, that happens. Like I don't feel that now, but yeah, probably after every surgery I've ever had, every repair surgery I've ever had, it's taken just a few months for feeling to come back. But it's strange where it can almost feel like you're touching it and you can feel it, but at the same time it feels like it's numb. It's hard to describe.
That's common in surgeries.
It's sensation, and then there's a little bit of ticklish feeling that once you lie down and then put your head without pillow, it's just a weird feeling. But that's what I was trying to find out. Back, I don't know how the FUE experience looks like. I have been told that FUE is a lot smoother. You recover within week or so time, and then after that you don't have this sensational feeling, right? Because the scars are all over the back of your head. It's not in one particular area.
Yeah.
So I went back to the Dr. Paneen after a 6-month review, and then I was looking at his board, and then almost every single appointment was FUE rather than FUT.
Uh-huh.
So that kind of tells me like why people prefer FUE over FUT, because I think the healing process is a little bit difficult, to be honest.
I tend to disagree. I think that if you and I went jogging and we both tripped and fell and we both hit our left knee, someone is going to feel it worse than the other. I have patients that will do a small FUE case and require more pain meds than a 3,500 graft FUT. Pain is subjective.
Are you there? And
yeah, Sam, sorry, Dr. Yaker is giving his opinion on what's going on. I'm sorry, I don't know why you can't hear him. It's the same settings from before.
Okay.
But yeah, Dr. Yaker was talking about how, and I understand this, I agree with him, how different people will respond to, like in his example, he's talking about if you go jogging together and you both fall and scrape your knee, one of you will feel it worse than the other. And it's a matter of tolerance, it's a matter of perspective, it's a matter of what you define as being painful, what you define as being annoying, just the way that you interpret disruptions to your body versus how other people do. So,
well, and also pain receptors, right? Some people will just be more sensitive, right?
Yeah, and he's also talking about how sensitivity can vary from one person to another. What I'll do, Sam, I'm going to let you go because I don't know if it's something going on with your phone call where you can't hear him, or if it's something on the system. But I'll let him make some more comments, and then you can listen to him on the radio or not on your streaming service that you're using.
Yep.
And he can address a couple more comments on that. Okay. Thanks for calling. All right, Doc. Did you have anything else you want to say about that for Sam?
Yeah, just very commonly when people have rhinoplasties, they have nose jobs. They'll say the same thing. It's that dull, kind of muted feeling. They kind of know their fingers there, but not. So that a lot of that is common with surgeries, right? From all the trauma and the disturbances that are going on with doing any form of surgery. So the good news is he's not having what I call zingers or this shocking sensations, things like that. That's more of the hyperactive nerves. But when it comes to pain tolerance, a lot of people choose FUE because they believe that it's less painful. But again, is that you?
Yeah, no, it's another call coming in. Go ahead, continue.
But I believe that first and foremost, pain is subjective. Like I had mentioned earlier, I can do a small case. Someone has a little bit more pain than someone with a large FUT. With the scalpel, you're making one big swoop, removing it and closing it. With FUE, you're making thousands of incisions. So square area of scarring is actually bigger with an FUE. But I do believe that, again, it is going to be case by case, patient by patient.
Yeah, fair enough. Fair enough. Okay, so let's see if this caller can hear you. Caller, you're on the line with Joe and Dr. Yaker. What's your name? Where are you calling from?
Joe is Spencer Coburn from Los Angeles.
Hello, Spencer Coburn from Los Angeles.
How are you? Listen, I had to interrupt my workouts, back day, by the way, to respond to Sam. He said something interesting, and I think it really speaks to, unfortunately, what people kind of want to hear, as opposed to the information we really provide sometimes on the program. Mm-hmm. The one thing that I always state, and I think you stated too, is that when you're dealing with strip surgery, anytime you're cut, first of all, once you're cut, but anytime you're cut, there will be nerve damage. Mm-hmm. And it usually, fortunately, recovers spontaneously. It could take, I don't know, up to 6 months, but in some cases, it could take years, 2 or 3 years or more to complete recovery. So that numb sensation or that tingling sensation or that feeling of sensitivity, it's pretty normal in a lot of cosmetic surgery, facelifts, and I don't think Joe could hear me, or maybe he could hear me but he can't respond. But it's a phenomenon, like Dr. Yaker was explaining, that for some people they're fully recovered in 3 months, mm-hmm. and for others, I've known guys who dealt with this for 5 years.
Yeah.
So it's really important when people are considering having any type of cosmetic surgery that this is a reality. But with that said, even though you're not supposed to do too much nerve damage with FUE, I've known guys that have had numbness from FUE for a long time, mm-hmm. and also tingling sensations.
Yeah.
So I just wanted to put that out there. I don't know if Joe could hear me. He can give his response, and then you can relay it to me.
But can you hear him?
Go.
Well, hang on. Joe,
you got the mixed minus effed up, man.
No, it's not. It's not the mixed minus. Doc, can you say hi to Spencer?
Spencer, can you hear me?
Did you hear him?
No.
See, I don't know what the hell's going on with this. Sorry. I didn't change anything. My mixed minus is fine.
Look, let's put it this way. You've gotten this almost down. It's not easy. I've been doing it for a long time, so I understand all the nuances of making this happen. So I'm just curious to hear what Joe has to think about what I said, because I could tell you this. Every time I mention strip, not only do I mention the reality of what could occur, but, it's real surgery. They're taking a peninsula of skin out of the back of your scalp and suturing that together. And once you're cut, you are essentially cutting nerves that have to, find their way back and recover. And in some cases, there are probably people walking around who had facelifts 20 years ago who still, they got used to it, but they still may feel a little numbness around their ear line or under their jaw. Mm-hmm. It happens.
Yeah.
The same is with forehead lifts. When they do the brow lift, the forehead lift, they'll have lack of sensation on the forehead, sometimes forever. My concern with
dead air is Joe talking.
That's Dr. Joe talking. I'll let you go, Spencer, so he can reference that and you can hear it.
Okay. Good job, guys.
Thanks, man.
Bye.
Bye. What I was concerned about is, from what I thought I heard with the gentleman from Chicago, is that he was having a little bit of pain, and at 11 months, that was more hyperactive nerves that are going on. But it's more what he was describing at the end was more just this dull feel. That is something that happens for others. They rebound right away, and for others, it could be a permanent thing.
Right.
But as long as there's no pain associated with it, I'd rather hear him say it feels weird because the sensation is a little bit off. That is something where you can live with. You can't live with, of course, significant pain and some shooting sensations that occur.
Of course. Yeah. That's something you don't want to live with. So what I'm going to do, I'm going to maybe take one more phone call, see if one adjustment I made fixed the issue. I don't think it did, because I don't think it's related. Actually, let's just kill the phone calls for right now, because the callers cannot hear Dr. Yaker. So we'll just switch over to the chat room. I saw some questions coming through there. Let me go up here. Or is patient seeing great results? Okay. HLC 2020, great supporter of this channel, asks, are your patients, Dr. Yaker, seeing great results with low-dose oral minoxidil or just similar to topical? Great question.
It is a great question. when it comes to oral minoxidil, obviously it's gained a lot of popularity, especially when that New York Times article came out a little bit ago. It went to everybody's inbox, everybody's Instagram, everyone was calling about it. I think it serves the right purpose for the right person. I'm still more old school and believe that the topical minoxidil is not only beneficial, but you're minimizing your systemic risk of side effects. I think that if someone is not going to be compliant with it or is having skin side effects with topical versions, then I completely understand. I have had patients who had no issues with topical. They were prescribed the oral by their PCP and had bad side effects.
Yeah.
I mean, people need to realize that just because it's been around for a long time doesn't mean they can't get it. And yes, it's low risk, but having certain side effects that are affecting the heart, especially fluid around the heart, things like that, we don't want it. I get more nervous about minoxidil when it's a middle-aged woman who's coming in. It's like, I don't want to put anything on my scalp. She's already on a few blood pressure medicines. Then you find out she's on a diuretic. She doesn't drink any water. And, she's not the strongest. And you put her on this, and now she's getting low blood pressure when she's standing up. And you have to be careful with it. Have I seen success with oral minoxidil? There's no doubt. I'm still going to be more old school and feel like if you're treating the area directly by applying the serum, the liquid, or the foam directly onto the scalp, it's still going to work very well because we know it does, but also you are going to minimize your risk of side effects.
I've been hesitant. Like I've always been interested in oral minoxidil. I got a great story. I think I told you about it one time, where a guy from Tasmania flew all the way to Vancouver to see me, not the doctors I was working for, but to see me because we've been in communication about his Norwood 6 hair loss, and he flew all the way to Vancouver just to show me his turnaround, where I'd never seen anything like it in my life.
Yeah.
Blew my mind. It was an Australian company that was offering their proprietary solution serum, whatever the hell it was, but they're also prescribing 10 mg of Lonitin. And that was my first experience with that. That was in the mid 2000s at some point. I don't remember exactly when. I'd never seen anything like it. I'd never seen like that since. Like it was a very unique one-off. And he was a full-blown Norwood 6, and not a diffused. It was just he had a lot of miniaturized hairs you could see, but it was way beyond diffused. And so that's when I became interested. But then I started, doing some research and looking at it and talking to the doctors. That whole cardiac side effect trumps any sort of ED that you might get with, oh, hell no. And
that's right. And there's data that shows that it works. This conversation is not necessarily that it doesn't work, because we know it does. Data does show, and I've seen the results. But my concern is just that all you need is one, right? You saw one guy that had a great outcome. And as we know, it's never one size fits all. You put 100 guys in here, everyone's going to respond differently to medicines, to foods, to surgery.
No, of course.
You never want to be on the other side or being the prescriber, and they end up having a pericardial effusion or something like that. So I take that. I if I'm going to do it, I really kind of go through the details as I do. But if it's a middle-aged woman, middle-aged male, I may just be a little bit careful of that.
Yeah, and that makes perfect sense. And over the years, Dr. Sergio Vano, I keep forgetting his name, big researcher in Spain. He's probably the foremost champion for oral minoxidil in Europe. And then Dr. What's his name in Australia? Starts with an S. Escapes me. Anyway, several people out there doing a lot of research in this, and a lot of patients actually showing some surprisingly robust turnarounds. Not nearly like I was talking about, but my point was it's been tempting for me, and it's becoming more and more tempting as people have or doctors have seemed to have standardized on a much lower dosage of 2.5 milligram, and that's great. But I'm still skeptical as far as the side effect profile. Like I just don't feel confident in its safety for myself. So that's why I've not jumped on board. But a lot of people are asking about it. Someone in the chat room asked if you would prescribe it. He says he lives 5 minutes from your office. He drives by your clinic every day. That's Chris Barrett. Do you prescribe oral minoxidil? The topical blends that I've tried have caused severe dermatological issues. If not, do you know of a Dallas-Fort Worth doctor who does?
So before I answer the question of oral minoxidil, the answer is yes, I will for the right person.
Yeah.
Let's back off and understand why we're getting skin issues. If we're using the over-the-counter minoxidil that are liquid-based, not foam-based, they have propylene glycol, which is a sister compound for antifreeze. And the reason for why it's put in there, it's put in a lot of things, right? It is. It's put in a lot of products that we use every day, is to prevent things from drying out and crystallizing. So if you're this big manufacturer that's making hundreds of thousands of bottles for all the grocery stores and all the pharmacies, it's bad for business if the manager of that grocery store or pharmacy says this whole batch dried out. So they have to put these compounds to make all the ingredients play nice and stay as a liquid solution. Yeah. Unfortunately, it causes in a lot of people, I mean, I'm going to say it's got to be anywhere from 8 to 12 or 8 to 15% of users, just based on my anecdotal clinical evidence here at the office, that they're either getting severe redness, itching, some people are getting pustules, dandruff. And so a lot of times it's due to actually being allergic to the propylene glycol in there or the preservatives in there. Can you be allergic to minoxidil? You can. It's very rare, but if you went to a propylene glycol free one and you still have issues, then you're likely allergic to the minoxidil. The foam, for a lot of people, they don't like the way it feels. It's very alcohol based, and so it's very drying. Yeah. So the alternative is when you compound things, the ones that we're offering, we don't put any propylene glycol, we don't have any preservatives. The downside to that is the shelf life is going to be a lot smaller. Mm-hmm. So you have to use it because it's like spoiled milk, right? But the benefit of that is with our patients, we just don't see dermatitis or any of the other symptoms that I explained because we're removing those key components that are causing it. So what I would tell this gentleman who's right by the office is consider going with one that doesn't have those ingredients, combine it with the topical finasteride, and you're going to see good results. And if you fail that therapy, then you can consider oral minoxidil at that time. But the reason for his skin issues are highly likely due to the fact that he's on the liquid minoxidil.
Okay, fair enough. That makes sense. Got some good questions coming through. See where to go. Okay, Hampton Hudson in the room. He's got a good question. He goes, I'm curious on Dr. Yaker's opinion on what the best percentage of topical finasteride is, 1.5 or 1%. I feel like it's the wild, wild west out here.
And he's right. It's the wild, wild west. And, when it comes to science, a lot of times it is going to be trial and error, but then at the same time you have egos where people are going to say, no, this works the best, no, this works the best. If you look at all the research, you have a ton on 1%, 0.25%. A lot of these big companies like Hims and others are using 0.3%. There is data to suggest that. But in terms of finding the sweet spot, I just don't think that we have that sweet spot. And again, I believe that it comes down to strength in numbers. When they're doing these research, these research articles to find out for anything, they're not 10,000 patients, right? We're not curing cancer. We're not finding a new way to treat blood pressure. So strength in numbers doesn't exist when it comes to a lot of our hair loss clinical research. You're going to have this guy who had 26 guys and 13 didn't show up to the follow-up, right? Yeah. So the problem is you just don't have strength in numbers. When we decided to look into it, we chose the 0.25%. And there was a lot more research that you can find that was on the 0.25%. I also talked about this with with the pharmacy that we're using, and we met with the two lead pharmacists, and we all agreed when in 2018 when we did this, that 0.25 was the good number. But it is the Wild West. We don't have an exact answer, and I guess in my opinion, you got to start somewhere. But I don't think that. I don't think that anytime soon we're going to have an exact dose for topical finasteride.
I think that's very well put because of exactly what you said. There's no supplier or resource that is putting together a large scale study like a proper study to be able to determine what that sweet spot is. So that's well said. Sergey in the chat room, he's got a great question here. This is back on the surgical side of things. Where did it go? It went here it is. Yeah. What are Dr. Yaker's main principles of ensuring good graft survival? Ooh, surgery. Good question.
I think that obviously when it comes to good graft survival, you obviously have to treat this with care, right? At the end of the day, it's all about figuring out the rhythm, the speed, the tempo, like anything else, and how you're grabbing these grafts or harvesting these grafts, whether it's FUE or FUT. I've seen some guys when they're doing FUT, they can't get that strip out quick enough. I mean, they're just zooming by. The transection rates are going to be there, right? Mm-hmm. It's all about, in my opinion, taking micro little bites at a time, going slow, making sure, because hair angles change from person to person, but also depending on the location of your donor area. From an FUE,
very well said. So, sorry to interrupt, but a lot of people don't realize that hair direction and angle changes from one area of the scalp to the next, both for placement and for extractions. It's very important for people to realize that. So I'm glad you said that, because very few people actually bring that point up.
Yeah, so your donor area does change, even from lower in the neckline and going upwards. But if you think about it, doing 2,000 graft surgery, FUE or FUT, is about 8,000 fine motor movements. You've got to remove the hairs, you've got to inspect the hairs, you've got to then make the incisions, and then you got to insert the grafts. Mm-hmm. So if you take that large scale number in the thousands, there is a high likelihood that some hairs may not survive, right? Yeah. But if you have the right team and you guys are a cohesive unit, everyone knows what everybody else is thinking, everyone is anticipating the next move. But more importantly, you respect those grafts, making sure they're hydrated, making sure they're not on the finger too long, making sure the LED light that is not right on top of the patient, mm-hmm. drying them out, and making sure they're in the right solution. And at the end of the day, it's not always what we do here. When the patient goes home, did they hit their head on that car when they got in? Are they spraying with the solution? Did they go tanning right after, which has happened with my patients? A lot of people don't follow rules just because that's just not their life, and that's fine. It's just not the way that they're built. That mm-hmm. everything always ends up okay. So we can do the best we can to operatively prepare the patient, do the best we can in that 8 to 10 hour day, whatever the case may be. As soon as you walk out of the office, if something doesn't grow, it's not necessarily what happened during the day. You have to make sure that you're treating it with the TLC, just like what we're doing as well during that day.
Right. Yeah. Well said. Well said. I noticed that when you're making your points, hitting your desk, it looks like you're so strong you're creating an earthquake because your camera starts shaking.
I'm definitely not strong.
If you don't mind, Doc, swing back around a little bit to your right again so you can be better centered. There you go. Yeah, because you're about half of you off screen. Very good there. Very good. Okay, so more questions here. We got, let's see. Yeah, here's a good question from Jose Bless. When's a good time to get PRP after hair transplant, and how often will I need to get it? Thank you.
Great question. That's also something that we don't have a definitive protocol for. Everyone's going to have their own ideas as to the protocols for that. We typically will do the intraoperative PRP like a lot of people do, and then we see our patients back at about 2 to 3 weeks, then 6 months, and then anywhere from 12 to 15 months unless they need to come in between those intervals. I like to do it at around the 4 to 6 month mark. You're starting to kind of wake up some grafts. Mm-hmm. 6 months just makes it easier because they're coming in for their halfway point, right? Typically around 50% of the grafts should be out and about. So we'll then do a PRP session there. And then when it comes to how much PRP you need after that, I don't have a protocol. I treat the patient right in front of me. So if he's on a DHT blocker, if he's hopefully also on minoxidil and any other additives or cherries on top like laser or PRP, that's great. Yeah. But as long as he or she is doing the most important thing, which is your finasteride and minoxidil, I like to see my patients every year until I retire. I don't say, hey, call us when you need us. So I actually do annual surveillance, no different than a wellness exam or a mole check from your dermatologist, because when you get your hair and you're happy and you're going about and life gets in the way, you may not be seeing what's going on in the crown. Mm-hmm. So what we do is we bring the patients in, we compare it to the photo studios the year before. It's a quick 15 minutes. Hey, how are you? How's life? Here's your pictures. You're good. You don't need anything. Yeah. I'm never going to push and add things that don't need it. Treat the patient for right now. So finasteride and or minoxidil are working well. Just keep seeing them every year, and maybe they never need it again. That's just the way that I work.
Well, I like that. Instead of having a standard system or a standard answer, say, well, we do it every 6 months or 3 times a year or what have you. I like that answer where it's, well, we just treat the patient that's sitting in front of us based on what we see today. Yeah, that's actually really solid. I'm glad you said that. We've not talked about that before.
Yeah,
so I appreciate hearing that.
A one time, or do you need a 3-pack? Every 4 to 6 weeks. I just wanted to bring the patient in. It's kind of like with testosterone. Unfortunately, there's a lot of unscrupulous wellness doctors that are throwing testosterone at every man and woman.
Yeah.
And instead of treating the patient's symptoms, they tell everybody that you have to be in this range based on your age. As we keep saying today, everybody is different. Everybody will have a different sensitivity. If the patient is sitting at an 800 to 1,000 male, his testosterone blood level is 800 to 1,000, and he's losing his hair like crazy, well, maybe we can get him to 500 or 600 or 700. He still feels the same as he did at 800 or 1,000, and we can reduce the sensitivity of the DHT.
Yeah.
But instead, every time I ask a patient, both man and woman, what's your testosterone level? Oh, I don't know. I was just told I'm in range. To me, that's not the right answer for hormones because of the sensitivity to that. Right. So I just treat what we see. We have objective evidence with the photo studio photos, and we start to see some breakdown or the patient reports shedding or thinning. Then we can approach it when that time comes, if that time comes.
Yeah, good. It claims that I should have had 99% of my growth by 4.5 months, while so far seems too good. So far seems to be good. Is this a claim that's viable? So
growth timelines, again, are going to be based on the individual. I will tell you that I've never seen 99% growth at 4 months. Typically 25+% at 4 months. Have I seen full growth at 7-8 months before? Sure. But again, it's really more the exception than the rule. This is a process that takes time. Your hairs, even though they were inserted at the same time, they all have different birth dates. They're in different cycles. But I can't say no. I don't know what he looked like before. I didn't see his post-op pictures to see where the grafts were placed, and then to see what he looks like at 4 months. I'd be more than happy to take a look if he wants to send me those photos. But I find if he's fully grown in at 4 months, then him and I should go get a lottery ticket today.
I'm telling you,
a little hard to believe that.
I'll go ahead and give my perspective on the idea that 99% of grafts should be grown in by 4.5 months. I think that's a load. For any clinic to throw that out as just a factual number, I don't think it. Number one, I think I don't know when they told you this. Was it before surgery or after surgery? But I think that in general, any clinic that's throwing out some sort of number like that so early, they either haven't been performing surgery very long for 4.5 months, like they just started, or they're maybe trying to make things seem a little bit better than they actually are.
And I'll add to what you're just saying. Basically, he may not have gotten the number of grafts that he paid for, and maybe he got less. And so maybe a little bit of showing, he goes, yeah, this is your full growth, because they didn't really give him the number of grafts he paid for. And again, I'm not trying to speak out of turn. I'm just throwing some ideas out there, because we do see that 4 months would be very hard. Like I said, I've seen it every once in a while. I've seen it, 7, 8 months, 9 months. It's very rare. And also, all these people are on finasteride minoxidil. That minoxidil kind of puts the hairs in the growth phase a little quicker, we've seen. But I can count on less than one hand where there was full growth under 9 months. Just haven't seen that. So hopefully he continues to get more growth. Like I said, if he wants to send me some pre-op photos, he can always get them from the physician. Hopefully they took some post-op photos so I can see where the grafts were placed, and then we can see what he looks like today. But
and I think at 6 months, I think that, like, I'm not sure why. And sorry, Hampton, I don't know the specifics, but if they're telling you you're at 6 months and they're telling you that 99% of your grafts should have sprouted at 4.5 months, were you saying that there's a problem? Were you asking where the or sorry, were they confirming that there's a problem if you're at 6 months and they're saying that 99% should have already sprouted and you're not seeing it? Like I wasn't clear on your perspective on this, but I will say that at 6 months, I generally believe that not even, I'd be surprised if 75% have come through. In my own experience, and a lot of patients I've dealt with, I've seen major turnarounds from month 6 to month 9 and 10, where patients would call me up and say, "What's going on? Where's the hair? This isn't what I expected. I was expecting more." And then 4 or 5 months later, they're like, never mind. This is good. So
and that's why we do the PRP at 6 months, because what you just said is exactly what I feel. The biggest leap, in my opinion, has always been between month 6 and 9. So we give that PRP as a little booster, and it really helps that process. But by 6 months, I always say on average, just to keep numbers simple for patients, you're about 50%, whether it's a little bit more, a little bit less. Sometimes we'll see 60+% just because of the topical finasteride minoxidil. And I've shown you, Joe, some pictures of people full grown at 9 months, but it is not very common.
Yeah. Okay. So Robert Heller wants to know if you perform beard hair transplantation, like from beard to scalp.
So I haven't gotten into that yet. I'm certainly not opposed to one day delving into it. I know that the technique can involve some very small punch devices that can leave some rather inconspicuous scars. But you also have to make sure that you know the skin types of your patients. You don't want to have hypopigmentation where there are a lot of white dots, and then you don't want hyperpigmentation. So when you have patients of certain races that have maybe darker skin, you really need to be careful, and you may want to even consider doing a test site, because you do not want pock marks on your neck and they're all white. I had a patient that saw me probably about 2019. He came in for a beard consult. I told him I just wanted to use the back of the scalp. He was more interested in beard to beard, and I told him that I didn't think it was safe based on what I saw with his skin type. He went to someone locally, and he comes at 6 months after that surgery, comes back and asks me what he can do, and he had thousands of dark red dots everywhere, and now he's going to have to do some laser and things like that. He hyperpigmented, and that was my concern when I looked at his skin. So I'm not opposed to doing it. I think it's a really unique, cool, additional way of getting hairs for your scalp. I just haven't gotten there yet.
Okay. And have you actually done beard transplantation from the scalp to the beard?
Oh yeah, that we do.
Yeah. Okay. So that's getting more popular. Let's see. What's his name?
I realize that the surface area of your face is bigger than this. And they're all one hair grafts as opposed to multiples. So it requires a lot, right? Yeah. We have about 30,000 hairs on our face on average, up to 30,000. So we're never going to give you that back, right? So it's important. So when I do my consults for facial hair, I go through those numbers. I'm like Rain Man. I want people to understand the brevity of what you're wanting me to do when you have like one Homer Simpson hair on the cheek. It's over 3,000. It's up to 4,000 sometimes. And I've done a 3,665 graft beard, and he looks like ZZ Top, and that's what he wanted. And we were here till 9:30 at night, and it was a fantastic thing for this gentleman because he had curly hair, and now it's down to here. Mm-hmm. But when people come in, they don't realize the how much hair is required to do a bold face.
Yeah, that's pretty amazing. I don't think I've heard that before. 30,000 hairs on your face for a proper beard. Interesting. You have
to understand, you're starting from the sideburns down.
Right.
Your bilateral cheeks, depending on the design. Right. Bigger guys have more hair, goatee, mustache, and then the connection.
See, how do your patients transition from topical medications to oral, especially Minox and finasteride blends? Good question.
Can you repeat that? I'm sorry?
How do your patients transition from topical meds to oral, especially considering minoxidil finasteride blends?
So typically it's reverse. I have most of our patients, they'll start on oral, and because we see more success with topical finasteride with minoxidil in my practice, we tend to actually get patients who, they go, hey, I need a little bit of an upgrade. What do you recommend? I'm certainly not saying we've never had a patient go from topical to oral. It's just not that common in my practice.
Okay. All right.
It's just not that common in my practice.
Ragnar Lodbrock, just reading a name in the chat room. My testosterone's 450. I have some symptoms of low T, like fatigue and brain fog. Although my diet and workout is on point, should I work on increasing testosterone, or will it raise DHT?
So yes, it will raise DHT. Testosterone is a factory to make DHT. But what I try to tell people is this is a sensitivity issue. If you and I go take a shot of tequila, it's the same volume. You're buzzing and I'm sober. You're more sensitive to the same volume. So you can't really say, okay, is this going to cause more hair loss? It certainly can, but it's because of how sensitive you are to the DHT you manufacture. So clearly, it would make sense that if you increase your T, you're producing more DHT, you're going to likely see more acceleration of your hair loss. You have a hair destiny. It was pre-programmed before you were born. And that destiny can come at any age. We can't predict that. But if you get on testosterone or a testosterone booster and you accelerate and you make more testosterone, which accelerates the formation of DHT, you just may get to your destiny quicker. And that's the important note that I always try to tell my patients. If you need to get on testosterone because you are actually having symptoms, go to your doctor, talk to them about it, but don't try to go to these crazy high numbers because yes, you're going to feel fantastic, but at some point there's going to be a side effect that's going to be associated with it, whether it's gynecomastia, acne, back knee, right? Horrible oily skin, rage, hypersexuality, and then of course hair loss.
Right. And how do you, and this is just my question, how do you scale up a DHT inhibitor if someone is taking testosterone to kind of compensate? Is that a situation where you just play with the dosage as they continue and you're seeing the effects?
So we've had really good success with the topical version because of the lowering of the DHT at the dermal papilla cell. I actually tell the patients, you need to manipulate your testosterone because you're like a boat and you've got holes. And I can plug up one of these holes with finasteride, right? Mm-hmm. But if your testosterone levels are 1,200, 1,500, I mean, these crazy numbers that I'm seeing, and a lot of times they didn't even know that it was that high because they don't know what that means. I need you to actually go back down. And so what I tell my patients is, let's find a balance where your symptoms stay away from low T, but we need to drive this T level down as low as we safely can, where you still feel good, but that way the DHT inhibitor, the finasteride, is still going to be able to work very well. Because as you know, if we're talking topical, there's only so much topical medication that can get into our skin. Our skin is a thick piece of tissue that only allows certain things to absorb, or else we'll have toxicity from shampoo, hair gels, hairspray, etc.
Right.
So you can put more drops on, but it's not going to absorb more, right? There's a level of saturation and absorption that can happen. So I don't mess with the finasteride yet. I try to tell these patients we've got to do something about lowering the testosterone.
Bring it down.
And the other problem we have with testosterone is that your hair gets so dry and brittle that we've done procedures on patients where just don't have good quality hair. It's just very dry and straw-like. And a lot of people with testosterone hair loss, it's usually very diffuse from front to back. And so that's very hard to treat from a surgical standpoint because you close one pothole or you sealed it, and now you see the other potholes. So a lot of times with a lot of our patients with a lot of testosterone, exogenous testosterone, they're so see-through through and through that you have to do this in stages for surgery. Okay.
Very good. Very good. See some more questions in the chat room. Guys, don't forget to like the program, like the video, please, as your way of thanking Dr. Yaker for taking some time out of his end-of-day schedule to spend with us and answering your questions. Let's see. Another question here. Does minoxidil actually work in increasing density?
So... when it comes, first off, it's important that people understand what the word density means, right? Density does not mean getting someone thicker and fuller, right? Density is the numbers or the quantities, right? So if my hands are spaced out, that's not very dense, this is dense. And everybody who comes in assumes that the word density means I'm going to get thicker. thickness is a characteristic of your hair, right? Your hair was your baseline, now it's thin, or you were born with thick hair, etc. Can hairs get thicker or rethicken with non-surgical treatments? The answer is yes. Are we going to make areas a lot more dense? It really just depends also where you're at, right? If you have multi-unit grafts, and let's say there's a 3 coming out and 1 is shrinking down, and it's more looking like a 2 graft unit, and you got on medication and it helped to restore that hair, now you've got a true 3, that's density, right?
Yeah.
But density is God-given. You're born with your number, and density, of course, fades with surgery and with time. Aging can thin your hair out, etc. But that's a tricky. I don't always like that discussion. We need to talk more of the word thick versus thin, not density.
I throw in the word fine versus thin, because fine is the hair shaft diameter, thin is the lack of density. And a lot of the terminology, a lot of even doctors will throw that around mistakenly, and so it is very important to understand exactly what it is you're asking. So that's really a good answer, Dr. Yaker. I appreciate that.
Density and fullness are the same. If you want to be fuller, you've got to restore density and fill in the blanks.
Right.
But if you are baseline fine hair and then you thin, you're obviously going to be more spaced out because the surface area and diameter of your fine hair just got even thinner. So now the neighbors get farther apart, and now you can see through your skin.
That's another good angle. Yeah, good way of putting it.
We're creating the illusion if we can re-thicken. I don't use the word regrow in my office. I don't like that word because it makes someone assume that the bald areas are going to come back. What we're doing is we're taking your wounded hairs, and if we can get them longer and thicker and fuller, or longer and thicker, I should say, it's going to give the appearance of being fuller, because if the diameters get wider, the neighbors get closer. And if we get on that early enough, maybe we can camouflage the scalp effect that's in between your hairs. So that's when we see a lot of great results with medication. What we've done is we've rebuilt those wounded hairs, got them thicker, closer together, and now you look denser because you're not seeing the spaces in between.
Okay, very good, very good. Let's see, there's a question that caught my eye. Where was this? Okay, so this is from It's Always Day One. That's his handle. He says, does MSM help with early growth and hair transplantation? And the second question is, how much minoxidil can speed the process?
So MSM is something that I put in our keratin supplement. 97% of your hair is made up of keratin, not biotin. Biotin, in my opinion, is unfortunately something that's been around for
And this
decades.
is interesting because we've never talked about this, and I'm a big believer in MSM. So
Me too. I have it in this formula that we make, and the reason why is MSM actually has proven studies. It's a wonderful antioxidant, anti-inflammatory, right? So we know that everything from hair to toe has, we have the need to try to create the ability to lower your inflammation, whether it's diet-induced or what have you. So if we know that science proves that MSM, which has been around for a long time, there's a lot of research, and it's truly helping as an antioxidant, anti-inflammatory, it's certainly beneficial. Unfortunately, smart guys like the gentleman caller here, he wants to know the definitive answer of how much better, right? Like minoxidil, how much better is it going to do? It is going to be more specific to the patient. Everybody's going to have a different response. I love minoxidil, but only synergistically with finasteride. We know that minoxidil is not that great, at least long-term, for men, because you're still allowing that DHT to attack through the back door. And that's why I don't care for minoxidil by itself unless you have to, because of side effects with finasteride or other reasons. Sure, it can help stave off. And then there's certain people that really have great success with minoxidil on their own. It's just going to be something where everybody's going to have it at their own potential outcome.
Have you ever taken MSM supplements by themselves, personally?
No. Well, sorry. I did when I was in college. I took like chondroitin and glucosamine and MSM, and that did actually help a lot. But the studies are out there also with those other supplements I mentioned. But I only took it for maybe like 6 months. But when I was looking for this supplement, I was kind of trying to find some antioxidant, anti-inflammatories, and it just kept coming up, and I remembered it. So I know it's a very, very good supplement.
I first learned about it 20 years ago, or about 18 years ago, when another patient that I knew personally, was it 19 years ago? It was right before I started working for the clinic. He started taking MSM, and he told me about it. And he was taking 3,000 milligrams a day, three horse pills, basically.
Yep.
And there's capsules with the powder inside. There's the hard actual tablets that are solidified, and you can also buy it as a loose powder, which I found interesting. You can buy it as a loose powder in the drugstore, actually. And I started using it myself back then. And I noticed an improvement in joint health in one knee that would flare up after I go running. And as he told me what happened, my nails started growing faster and my hair started growing faster. And not just faster, but it does feel and look like it does have a bit more, I want to say volume, but I think that that might be a little generous with the description. But there's definitely... I can definitely feel and see something different after using it for a few months. And
I'm a big fan of that. I am a big fan of that.
Yeah, and I remember when I was first doing my research on it, there were actually some people out there who were advocating for 20,000 milligrams a day, like saying it was. I mean, that's just ridiculous. But there's I actually want to get, if you have access to those studies, I'd like to learn more, because I'm thinking about doing a video on MSM. For the channel, because I think it'd be an interesting subject to talk about. Let's go to chat room again. Let's see if we've got questions. Okay, a lot of medical questions here as far as finasteride. First off, do you know what Cosma RNA is?
What was that?
Cosma RNA.
I think I saw it on Follicle Thought recently. I didn't get a chance to read the entire article, so I apologize. I just don't have enough background.
No, that's fine. Yeah, it's not available yet, but it's supposed to be. I think this is the product, and Hair Loss Cure 2020 in the chat room can confirm this for me. I think it's supposed to be out last month, and it still hasn't been released in Europe, which is where they're aiming for. Ragnar Lodbrock says, "What's the minimum dose of finasteride that you've seen work well in a patient?"
Oral finasteride is what I'm assuming he's talking about.
Yeah.
We've seen those studies that 3 milligrams a week is beneficial for stability.
Yeah.
I actually hold true to that. I have some patients that don't want to do this 7 days a week, and the finasteride that we offer is a little bit more. It's 1.25 milligrams, but we have a lot of patients that just do it 3 days a week, and that's totally fine. We're seeing stability because of the annual surveillance. We're not seeing any issues at all. I also tell people when they get on it, it's also okay to titrate up. Start with 2 or 3 pills a week. Yeah. Do that for a few weeks, then add a day. Do that for a few weeks and slowly build, because the mind is such a powerful thing. We know the nocebo effect is real. We know that you freak yourself out every time you open that jar to take your medicine, that there's going to be a potential chance that you're going to have a sexual side effect. And we know that there's 10 plus medical conditions that can help cause ED and decrease libido. But one of them is overthinking and stress and anxiety, even over your hair loss, but also opening that jar every time. So I just tell people, go nice and slow, take 2 or 3 a week, go up after a few weeks, and just slowly titrate up until you feel comfortable. If we can get to that, 7 days, I'm still a fan of the 7 days a week, but I really do base that on the individual and what their worry is. And I'll call them after a month or 2 and check on them and see if we can add some things. And more times than not, they're like, I freaked out for nothing. What I think is this, obviously our manhood is very important, but if I was allergic to strawberries and you watched me need an EpiPen because my throat was closing in, would you stop eating strawberries? No. So when people go to these forums and they go to these websites, it's a vortex of negativity, because people who are out living their lives without any issues with finasteride are not going to go spend time and go on these websites, right? It's the same thing like I call the Amazon effect. You're not going to read the 5 stars, you're going to read the 1 stars. So when you start going down this rabbit hole of negativity, and I had this problem, and Bill from Indiana had a problem, and this and that and the other, You also don't know the entire story, not saying they're not telling the truth, but there could be more of the story that is not being shared. I just tell people, we know you have hair loss. We know there's a likelihood, 100% chance you're going to keep going, and there's a small percent chance that you may have a side effect. The choice is yours because this isn't going to save your life. You get to make the decision to try it. And if that is something that they're willing to do, I just start them really, really slow, a couple of weeks, and then we just build it up.
I like the mention of titrating up. You're the first. I don't recall if we've ever talked about this, but you're the first doctor I've heard actually talking about titrating up to test it out. And what I've been saying for years is if you want to give it a shot to titrate up, starting off with 1 pill a week for a month.
You do that
like every Monday, and then the second month Mondays and Thursdays. The third month Monday, Wednesday, Friday. And keep going up till you can get to that 7-day. But if you get to the point where you're starting to get side effects, you got two options. You can push through, and you can correct me with your opinion. But I find that a lot of patients that push that give it a real chance, the side effects will diminish after several weeks, and they can continue at that dosage. But if you're afraid of it, nothing wrong with that. You can bump back to the previous level. So if you're at 5 times a week, you could bump back to 3 times a week and hold steady there, and that might be fine for you. But ultimately, titrating up and monitoring it and keeping in mind what your options are, I think that's solid. It's worked really well for a lot of people I've talked to about it.
Yeah, and again, there's no specific protocol for titrating up or titrating down when someone does have side effects, right?
Yeah.
We know that every doctor is going to have their own protocol. There's some doctors that as soon as you have a side effect, stop it for 7 to 10 days, and then resume at the level you were when you didn't have it, or start with 1 or 2 weeks. There's no rhyme or reason as to how someone is going to be able to titrate up or down. You just have to play with it, and you can have 10 guys that start with 3 a week or 1 a week, and some's going to have a problem, some's not. So there's nothing about this that's universal, which is the same thing you can say for most things in life. Nothing is universal. Everybody will feel different, act different, react different. And so you have to be able to manage the person, because he's a person or she's a person and not a number. This is not a masses kind of thing. You just got to talk to the patient, and that's all you got to do. Figure it out.
There you go. Well said. I think that we got time for one more question. And that would be, again, from Ragnar Lodbrok. How do you guys come up with these names? He says, brain fog. No, hang on. He's got brain fog. It's not going away. I'm losing hope at this point. Thinking of switching to dutasteride. Will this cause even more brain fog? That's a really good question. I'll give my opinion on this. I can't say it will or will not give the same side effect, but there are a lot of cases where someone's been taking finasteride, they switch to dutasteride, and it works out great for them. Side effects disappear, they still get a benefit, and they're good. I've also seen the other way around as well. Someone's taking dutasteride, they move on to finasteride, and any side effects they had on dutasteride do not manifest. And I've seen it, the third option, where, the side effects do transfer over because they're both DHT inhibitors, slightly different mechanisms, but there's a sensitivity level that each patient has. Dr. Yaker was talking about it before, that can affect that. So, Doc, what do you think of that?
Yeah, and it's the same thing. It's not one size fits all. So the obvious thing is we know that dutasteride blocks both pathways. We also know there's a longer half-life. So if you have an issue, potentially it's going to take longer to get out of your system. I read a study, I think 6 or 9 months ago, and again, studies are small sample. They're going to say this versus say that, but they actually, when they pitted finasteride versus dutasteride in terms of side effects, the sexual side effects weren't any more with dutasteride because it's stronger with longer half-life. The only change they saw was more in terms of the semen parameters. So they actually had more of a lowering of the semen numbers than with finasteride. So I will tell you this: if I have a patient that's on finasteride,
sorry to interrupt. Do you mean the sperm counts or the semen volume?
The sperm. It was semen volume. It was
okay.
Semen volume.
Yeah.
So when I have a patient that's maybe been on finasteride for a long time and they don't want to move to topical, which I'm a big fan of. We'll prescribe them to dutasteride, also starting them slowly, things like that. I have yet, and I've been doing this since 2015, I've yet to have a patient with new onset side effects when we go from finasteride to dutasteride.
Okay.
I've had patients who I've met coming in for a consult and they say they've tried it and they had an issue, but not with going from finasteride to dutasteride. So it can happen, I just haven't really seen it.
Okay, fair enough. So I think I'm having another technical difficulty, and that would have to do with my camera. My shot is frozen.
Yes,
not sure why. My shot is frozen, so you can't see. Like, I just got undressed and it looks fantastic, but you guys will never know. But I'd like to thank Dr. Yaker for coming on and sharing his knowledge, his experience, and getting to know you guys, and you guys getting to know him right here on The Main Event. Doc, thank you so much for joining us. I'm going to let you go, and I hope you have a great evening, and hope your dogs aren't going to be too upset with you.
My pleasure. Thanks a lot. I'd be more than happy to come back on and we can get through some other questions when they can hear me.
Sounds good. Yeah, absolutely. We'll do that for sure. Thanks a lot.
All right. Thanks again.
All right. Bye-bye.
Bye.
So you can't see me moving or talking, but you can hear me. So I'm going I don't know what's going on. So yeah, we're going to wrap this up. Again, thanks to Dr. Joseph Yaker out of Yaker Hair Restoration in Plano, Texas. That's basically Dallas, Texas. He is a Hair Transplant Mentor accepted member. I was really excited to bring him on board, and just a little backstory on that. It was just over 2 years ago, and he's one of these doctors where I was surprised he was as good as he is, and I hadn't heard of him yet. And so I invite everyone to go check out his website. It's yakermd.com. Pretty sure that's it, yakermd.com. Or you can just go to my website, hairtransplantmentor.com, and under the doctors section in North America, you can find my write-up about him and a link to his website. Good guy, good doctor, and of course, obviously he gains my recommendation as a clinic to consider. So with that said, everyone, I am out of here. Thank you for your patience in these technical difficulties. Hope you have a wonderful, wonderful Thursday evening, and we'll see you tomorrow, same time, right here on the Hair Transplant channel. Spencer Coburn's The Bald Truth with me, Joe Tillman. Everyone take care. Bye-bye.